All right, types of IV fluids. IV fluids. Patients are prescribed an IV solution or fluid based on their electrolyte and fluid volume status. IV fluids are commonly categorized as colloids and crystalloids. Colloid solutions contain large molecules that cannot pass through semi-permeable membranes and are used to expand intravascular volume by drawing fluid from the extravascular space via a high osmotic pressure. Examples of colloid solutions are your albumins, your dextrans, and your hydroxyl starches. A crystalloid solution contains solutes such as electrolytes or dextrose, which are easily mixed and dissolvable in a solution. Just think of salt and water. Crystalloids contain small molecules that flow easily across semi-permeable membranes, which allows for transfer from the bloodstream into the cells and tissues. They may increase fluid volume in interstitial and intravascular space. Example of crystalloid solutions are your isotonic, hypotonic, and hypertonic solutions. So what are isotonic solutions? Well, they have an osmolality of 250 to 375 milliosmoles per liter. Now they have the same osmotic pressure as plasma, creating a constant pressure inside and outside of the cells, which causes the cells to remain the same, meaning they will not shrink or swell. And they do not cause any shift of fluid within the compartments. Isotonic solutions are useful to increase intravascular volume. And they're, typically used to treat vomiting, diarrhea, shock, metabolic acidosis, and for resuscitation purposes. And they are also used in the administration of blood and blood products. Examples of isotonic solutions include your normal saline, your 0.9, your lactated ringers, your 5% dextrose in water, which is a D5W, and your ringer solution. It is important to monitor patients receiving isotonic solutions for fluid volume overload or hypervolemia. So then what is our hypotonic solutions? Well, they have a lower concentrate and of solutes, and they have an osmolality equal to or less than 250 milliosmoles per liter. The infusion of a hypotonic solution lowers the osmolality within the vascular space and causes that fluid to shift to the intracellular or interstitial space. Cells will swell, but may also delete fluid within the vascular space. Examples of hypotonic solutions include a 0.45% sodium chloride, a 0.3% sodium chloride, a 2.5% dextrose in water, and a 0.2% sodium chloride. We have to monitor for hypovolemia and hypotension related to fluid shifting out of the vascular space, and we do not administer to patients with an increased intracranial pressure, as it may exacerbate cerebral edema. We also want to use cautiously in patients with burns, liver failure, and traumas. Hypertonic solutions are solutions that have a higher concentration of solutes and have an osmolality equal to or greater than 375 milliosmoles per liter. The osmotic pressure gradient draws water out of the intracellular space into the extracellular space. Examples of hypertonic solutions include your D5Ws, your 0.45 solution sodium chloride, and your D10W, and a 3% sodium chloride. Hypertonic solutions may cause intravascular fluid volume overload and pulmonary edema and should not be used for an extended period of time. Hypertonic solutions should not be used in patients with heart or renal disease or who are dehydrated. Although all IV fluids must be administered carefully, hypertonic solutions are additionally risky. In order for IV fluids may be continuous or as a bolus, depending on the needs of the patient. IV solutions are available in 25 ml to 1,000 ml bags. The frequency, duration, amount, and additives to solution must be ordered by a physician or nurse practitioner or a physician's assistant. For example, an order may be given to give normal saline 125 ml per hour. The most common types of solution include normal saline and D5W. Patients may also have medications such as potassium chloride, thiamine, multivitamins added to an IV solution. To discontinue an IV infusion, an order must be obtained from the physician, nurse, or nurse practitioner or physician's assistant.